You know that feeling when something just doesn't feel right down there? That nagging discomfort that makes you shift in your seat during meetings or keeps you up at night? What if I told you that a habit millions of men consider completely harmless could actually be wreaking havoc on your prostate health? Today, we're diving deep into three major ways excessive masturbation impacts your prostate. And trust me, what you're about to learn will change how you think about this common practice forever. Let's start with the first major harm: chronic inflammation and prostate congestion. Every time you masturbate, your prostate goes through an intense cycle of engorgement and release. Think of your prostate like a sponge that fills with fluid and then squeezes out. Now, when this happens occasionally, it's perfectly normal. But when you're doing this multiple times a day or even daily for years, you're essentially overworking this delicate gland. The prostate becomes chronically inflamed, swollen, and congested with fluid that doesn't fully drain. This is like repeatedly clenching and unclenching your fist until your hand cramps up and stays partially closed. The constant stimulation causes blood vessels in the area to remain dilated, creating a state of perpetual inflammation. Over time, this leads to a condition called chronic pelvic pain syndrome, which affects up to 15% of men at some point in their lives. The symptoms are brutal: burning during urination, constant feeling of fullness, pain that radiates to your lower back and testicles, and difficulty sitting comfortably. What's worse is that this inflammation creates the perfect breeding ground for bacterial infections, turning your prostate into a ticking time bomb for prostatitis. The second major harm involves hormonal chaos and zinc depletion. Here's something most men don't realize: your prostate is essentially a hormone factory, and every ejaculation depletes critical nutrients, especially zinc. Your prostate contains the highest concentration of zinc in your entire body, about 10 times more than your blood. Each time you ejaculate, you're losing between 1 to 3 milligrams of zinc. Now multiply that by frequent masturbation habits, and you're looking at a serious deficiency. Zinc isn't just another mineral, it's the guardian of your prostate health. It regulates testosterone conversion, prevents abnormal cell growth, and maintains the structural integrity of prostate tissue. When zinc levels drop, your body starts converting more testosterone into dihydrotestosterone, or DHT, the hormone directly linked to prostate enlargement. This creates a vicious cycle where low zinc leads to more DHT, which causes prostate swelling, which makes you more prone to infections and inflammation. Studies have shown that men with chronic prostatitis have zinc levels up to 50% lower than healthy men. But it gets worse. The hormonal roller coaster from frequent masturbation disrupts your entire endocrine system. You get spikes of dopamine, followed by crashes, elevated prolactin levels that suppress testosterone, and cortisol surges that further inflame your prostate. This hormonal chaos doesn't just affect your prostate, it impacts your energy levels, mood, sleep quality, and even your ability to maintain muscle mass. The third and perhaps most serious harm is the development of neural hypersensitivity and pelvic floor dysfunction. Your pelvic floor muscles are like a hammock supporting your prostate, bladder, and rectum. During masturbation and ejaculation, these muscles contract intensely. Frequent masturbation, especially with aggressive techniques or while sitting in poor positions, causes these muscles to become chronically tight and dysfunctional. Imagine holding a heavy grocery bag with your arm bent for hours. Eventually, your arm would cramp, shake, and struggle to relax even after you put the bag down. That's exactly what happens to your pelvic floor. The muscles develop trigger points, areas of constant tension that send pain signals throughout your pelvis. This creates a phenomenon called neural wind-up, where your nervous system becomes hypersensitive to any stimulation in the area. Normal activities like sitting, walking, or even wearing tight clothing can trigger pain. The prostate, surrounded by these dysfunctional muscles, gets compressed and irritated constantly. Blood flow becomes restricted, waste products accumulate, and the tissue begins to deteriorate. Men with pelvic floor dysfunction often describe it as feeling like they're sitting on a golf ball or having a constant urge to urinate even with an empty bladder. The neural pathways become so sensitized that the brain starts interpreting normal sensations as pain, creating a chronic pain condition that can persist for years even after stopping the harmful behavior. Now here's where things get really interesting. When you reduce excessive masturbation and give your prostate time to heal, the transformations are remarkable. Within just 2 weeks, inflammation markers begin to drop significantly. Your zinc levels start to restore, allowing your prostate to rebuild its protective mechanisms. The pelvic floor muscles begin to relax and reset, improving blood flow and reducing compression on the prostate. Men report dramatic improvements in urinary function, with stronger streams, complete emptying, and no more midnight bathroom trips. Sexual function actually improves too, with harder erections, increased sensitivity in a good way, and more satisfying experiences with partners. The hormonal balance restoration leads to better sleep, improved mood, increased energy, and even enhanced cognitive function. Your risk of developing benign prostatic hyperplasia drops significantly, and you're essentially adding years of healthy function to your prostate's lifespan. But let's be clear about something crucial. This isn't about complete abstinence or shame. It's about understanding that your prostate, like any other organ, has limits and needs respect. The key is finding your individual balance. For most men, limiting ejaculation to once or twice per week allows for optimal prostate health while still maintaining a healthy sex life. Focus on quality over quantity. When you do engage in sexual activity, make it meaningful and mindful rather than a mindless habit or stress response. Incorporate prostate-healthy practices like regular exercise, especially walking and swimming, which improve pelvic blood flow. Stay hydrated to flush toxins, eat zinc-rich foods like pumpkin seeds and oysters, and consider supplements like saw palmetto and beta-sitosterol. Practice pelvic floor relaxation exercises and deep breathing to counteract tension. Most importantly, listen to your body. If you're experiencing any discomfort, frequent urination, or pain, your prostate is telling you to slow down. The bottom line is this: your prostate health determines your quality of life as you age. The habits you form now in your 20s, 30s, and 40s directly impact whether you'll be dealing with chronic pain, surgical interventions, and sexual dysfunction in your later years, or enjoying vitality and freedom. Every time you choose moderation over excess, you're investing in your future self. You're choosing to be the man who's still hiking mountains in his 70s rather than scheduling prostate procedures. The science is clear, the evidence is overwhelming, and the choice is yours. Take control of your prostate health today, because tomorrow it might be too late. If this information opened your eyes, share it with someone who needs to hear it. Subscribe for more honest health content that mainstream media won't tell you. Your prostate will thank you.